Well, for the last, I don't know how many weeks now, and we've been doing this, we've been chatting with the Minister for Health and Social Care, and he's really joining us now, David Ashford. Thank you very much indeed. Although it looks like you might have had a quite interesting night last night, according to social media. Pictures of you appearing?
Well, Friday night, Paul, yes, I nipped out for a drink in the Outback, and next thing, a few photos were taken.
It's been interesting, though. How do you think you've really been able to communicate well with all ages? Because these were younger people who probably don't think would even know necessarily who their local MHK is, and yet they know about you and what you're doing.
Well, I think everyone of all age groups has engaged over the pandemic, and perhaps come to see government slightly different to how they did beforehand. I think it's important government keeps up that public engagement, and I think there's probably government itself has probably learnt lessons throughout this about how the way we communicate with the public, and hopefully they're lessons that will remain in place for a long time to come.
And social media is always there to remind us of certain events, like me and the Chief Minister at the press conference. You got that as well, did you?
I received that from multiple sources, Paul. Yes, the very good video editing going on there.
I should explain that me and Howard Quayle, we've known each other for many, many years, and we do interviews in person. We normally have a bit of a Josh anyway beforehand. Maybe I should dig some of those out just to balance it up. I don't know. Anyway, shall we start with some questions?
Yeah, of course.
Okay. Can you ask about distancing and PPE? Why the sudden change to drop distancing? Was it financial or health decision? Was it to get the schools back, pubs and restaurants open, or to get tax revenue before support packages run out?
Well, the one thing it wasn't was the last one. Everything else, I would say it was a mixture of the lot. It was a health-based decision because we'd reached the point where our transmission in the community was low or even zero, as the phrase has been used over the last week, reaching local elimination with the 28 days, which is 2 full incubation periods of the virus without cases. So there was no point keeping the social distancing in place longer than it needed to. Obviously, if the situation changes, then in future we may have to look to go back to it. I certainly hope not, but obviously all options are still on the table. But it does give us an opportunity to create what the Chief Minister called the other day the Manx bubble effect. So we can get our schools open, we can get our economy back up and running, and it's all been down to the hard work of the Manx people that we've been able to get into that situation.
I mean, these questions come up all the time, and I appreciate you sometimes they do change the answers, but I'll read them out anyway. I mean, this one: do you know if the government have mentioned if they have extended the PCR testing programme to those entering at the border? In light of the recent developments in New Zealand, will the government review the current arrangements in testing those arrivals throughout the mandatory 14-day isolation period, given there seems to be no longer any tangible demand for testing from key workers or the community? New Zealand have now changed their own policy to any arrival being released from their location is to be tested and must have a negative result before being released. Will the island now follow suit? If not, why?
No, we won't, and the reason being that if you're in the early stages of incubation with PCR testing, then it won't show up potentially as a positive result anyway. But what we have is the more stricter defence, which is you must self-isolate for the 14 days, which is the incubation period of the virus. So since people are self-isolating for those 14 days anyway and are directed to do so by law, testing them doesn't actually add anything to that, because even if they're tested and come back negative, people won't be able to go out prior to the 14 days.
And that whole thing with those 2 people from the UK getting out to New Zealand, do you know the ins and outs yet? Exactly how they seem to...
It appears, unfortunately, to have been a breakdown in the process by the New Zealand Ministry of Health. What they had in place was with compassionate travel, where someone is coming in, say, to visit a dying relative or something like that. They go into the quarantine centre, then they do what we've referred to before about the double test, the double PCR test. In the case of these 2 individuals, however, the breakdown happened. They weren't tested at all. They were just let out. One of the ladies concerned from the UK had been feeling like she had a cold or something similar, but she put it down to another health condition that she had, and unfortunately then they tested positive. So it wasn't the case of the 2 ladies breaching anything. It was the fact of the process in New Zealand fell over, and that's why they've now taken measures to move pretty much in line with us, where they're saying even if you're coming in on compassionate grounds, you must do 14 days.
Right. Here's a question that I've actually asked you some time ago now and didn't actually get an update, so this is good to come to this one now. The death rate, can we find out what would have been the death rate at this time of year, and obviously with the differences with COVID-19? At the time, the Minister said he hadn't got the data to hand. I find that strange. Surely we know how many people are dying.
The death rate, well, what happens with the death rate is it's calculated on a quarterly basis, because obviously everything's got to feed through into the registry. So it's not a case of you have a live feed as to how many people are dying and what they're dying of, because there's a full process behind it. So some are awaiting coroner's inquests and so on to determine cause of death. So it's not something that you would have live figures for and say today, this is where we stand. My understanding is that the death rate has barely changed. Obviously, we have had deaths in terms of COVID-19, 24 deaths in total, but we've not. But the overall death rate on the island isn't substantially different, other than those 24 deaths.
It isn't substantially different.
From other,
Yes.
Obviously we've got those additional COVID
Yes.
deaths, but in terms of the death rate from other things, we've not seen an increase.
So did we overreact, do you think, then, looking back?
No, I don't think we did overreact. I mean, 24 people, unfortunately, in our community did lose their lives. I think if we hadn't taken the steps that we took to shut everything down very quickly, to try and shield the vulnerable, then unfortunately, I think we could have seen what other jurisdictions have seen, where that number was actually an awful lot higher.
Right. This one, I think we've asked this before, about DHSC and the Benefits Office, and when will they be fully opened? I think we touched on that one before. Are they open now?
Yeah, so there's processes in place that not all counter services have been restored in terms of the Benefits Office. The reason being that all of those staff were redeployed to other roles. So some, for instance, went into the contact tracing team. Now, obviously, we still need to keep an element of contact tracing ongoing. Certainly within DHSC, we've deployed people into public health. We redeployed people into other frontline roles and also into COVID testing. We still need to keep a testing capacity. We still need to keep contact tracing, because although we are now, past 30 days of no cases, there is still always the risk that the virus can rear its head again. So we've got to keep some of that switched on. But we are now slowly starting to transfer people back in, but it's not an instantaneous process, because if we just move everyone back to what they were doing before, then we're basically switching off our COVID capacity. But there are plans in place to get counter services and everything else back restored to normal.
And this person goes on to ask about job centres and the tax office. Are they back up? Obviously, people looking for jobs and people having a tax issue, problems that need to be resolved.
They're not open for face-to-face at the moment, but again, as I say, that's looking at redeploying people back. But the numbers and the ability to contact the tax office and also the job centre is still there. It hasn't gone anywhere during the pandemic. That support has always been there. And
there's one here about banks, and I see Minister Boots kind of weighed in as well. Certain banks don't seem to have reopened it properly, and there's nothing you can do about that. That's just down to them, isn't it?
I mean, well, it's a business decision from businesses. I think in terms of the banks, obviously a lot of them will be working off their head office policies, because the banks are part of larger groups. Now, same with some shops I've noticed that have kept the social distancing in place. Some will have head office policies that the regional branches, even here in the Isle of Man, still need to comply with. So people need to be aware of that. But as I've said, how businesses operate is a matter for them, which I think I mentioned in our last interview, as some may decide to keep social distancing because they believe it's still appropriate for their staff and customers, and that's a decision for them. And as for some businesses, when they reopen, particularly bank branches, I think it'll be good for the banks to engage with the MHKs around what their long-term plans are.
Okay, we'll talk about social distancing. I brought that question up, which was literally hot off the press, and I appreciate that maybe you didn't quite get what I was trying to get to at that time. That the app that the UK were working on, they got rid of it. They're now going with the Google and Apple thing, and the potential is there. And you weren't maybe too keen on the idea, but surely, again, just maybe to finish that one off, tracing it like that is going to be probably the only way forward, isn't it? Eventually, when we do open the borders.
Well, not necessarily, Paul, because I mean, what we've got to remember is the Google and Apple thing isn't an app in itself. It's a base off which an app can be designed. So, for instance, Germany has based their app via the Google and Apple. But what matters with an app, as I think I've mentioned before, is the uptake. That is what is crucial, because contact tracing does not work if you haven't got the people around you using that app. Because that's the whole purpose of it. The phones actually check who's around them and will actually be able to communicate to isolate that person. If the people you are passing do not have that app on their phone,
do you not think
then it is ineffective.
Do you not think at some point in the future Android and Apple will just have it in their software? It will be a default on and it'll just be there?
I think they might encounter, certainly in a lot of jurisdictions, legal issues around that because people will not have consented to that kind of track and trace. As individuals, so I think there would have to be a lot of legal issues to iron out there. Germany's app has been going very well. As I've said before, you need about a 40% uptake. Germany, who's been praised in a lot of the media over the last couple of days for their app, their uptake so far has just passed the 6 million mark, which sounds brilliant. But when you do it as a percentage of population of Germany, that's about between 7 and 8%. Well, I know, so still well short of the 40.
Anyone's got an Apple and they have to find my phone switched on, it can be a great relief to know that your phone is tracking you. But anyway, that's another thing.
It can, but remember with Find Your Phone, you actually, as the app, you have to download it and you have to consent to having that on your phone.
It's inevitable that a second wave will come to the Isle of Man. I hear Nobles Hospital are already reconfiguring wards and services to prepare for it. The government really needs to be planning a strategy for when the borders do open and a second wave and a second lockdown come. I don't think there's any way we can avoid it.
Well, the first thing I want to clear up is Nobles Hospital. We are not reconfiguring the wards for a second wave. We are actually reconfiguring wards back to where they were previously. Prior to the pandemic, because there were certain wards that of course became COVID cohort wards, we are actually reconfiguring those wards back to normal service. So that is a complete rumour that is not true. In relation to any second wave, I've said all along, and I know the Chief Minister's echoed it many times as well, that we do have to be ready for a second wave. With my history hat on, I keep pointing out about Spanish flu, which ran from 1919 to 1921, that actually came in 4 waves. So it would be completely remiss if we didn't plan for that, and that is precisely why we're keeping tracking and tracing in place. That is why we are keeping our capacity for COVID testing. That is exactly why we went to self-resilience with the oxygen plant, why we've got the Newlands converted ward that will be remaining as it is for now, so that we can deal with any issues that emerge should a second wave go around the world.
This week on social media there was a lot of interest in a flight that came in from Jersey, and I'm sure you're aware of this. It seemed to have health people on board, people asking why they were allowed in, what was the risk factor taken, and they went back again, and they didn't obviously isolate here. Can you give us any more information about what that was all about?
Right. In terms of a private aircraft can come in as long as they've got prior permission. So it's not just a case of someone rocks up in a private aircraft and they can land at Ronald's Way. They obviously need air traffic control permission to land. They go through the same process with the Cabinet Office, where there has to be exemptions issued. When they get off their private plane, they are dealt with exactly the same way as anyone else. So they are issued with a legal direction notice that means that they have to self-isolate. So when they are not doing whatever job they've been brought in to do. So they will be allowed to go from the aircraft to do whatever work they've been brought in, which would be, in this case, national infrastructure work. And then when they're outside their job, they have to return either directly to their hotel if they're staying on Ireland, where they've got to isolate away from others, or return immediately from the port. And in my understanding is it was in one day and straight back out again. That's exactly the policy that's in place for all key workers.
Fine. The government's getting big PR spin about people wanting now to move to the island, but of course they can't. Would potential house buyers maybe get special dispensation to come to look at houses?
Well, just to clarify, people can move to the island as long as they can show that they have actually entered into a contract of rental or that they've entered into a contract to buy. That was a change in policy probably about 4 weeks ago now. So there is the ability to move to the island as long as you can prove that that's what you've actually done at that point. In terms of viewing houses, no, there wouldn't be an exemption for someone to come over and view a house. That is why with the estate agents we've said all along, about the virtual viewings and people being able to see things online. But no, someone wouldn't be able to get an exemption to come in just to view a house. They can move to the island, but only if they can show they've entered either into a contract of purchase or a contract of long-term rental.
Okay, what's the situation with the 3 medics that still carried the COVID virus within their systems? You mentioned that over a week ago, wasn't it, that these people had come back into their system. Are they back at work? Are they off? Are they self-isolating as they were infected some time ago?
My understanding is 2 are now clear. I don't know about the 3rd. I don't have an update on the 3rd, but I believe 2 of the 3 are now clear. As I've stated previously, this is shedding, so it doesn't mean they necessarily have the virus. They are still shedding the RNA of the virus out of their system. So it doesn't mean they were contagious. It doesn't mean they couldn't necessarily return to work. The issue we had was around our policies of return to work, which in the relation to certainly one of the individuals who worked for government, the issue was that the policy said that they couldn't return to work until they'd had 2 clear negative tests. So although they tested negative on the first test, because the viral shedding continued after that, the next 2 came back positive, so that meant they couldn't return to work. So when it comes to viral shedding, we would need to change our policy in relation to that.
Okay. We've moved an event at the Villa to next year, but now it's open. We tried to get a new date this year, but told that all tickets had already been moved to next year. Is there anything that can be done? And I suppose on top of that, you still got this risk that you could pull the plug on this at any time again if we do get more infections, right?
Well, yeah, I mean, obviously, myself and the Chief Minister have both made perfectly clear it's not a one-way street. If a second wave did hit, and we would have to look to try and reverse things. Obviously, we hope that's not going to be the case, but we do have to be practical about these things and say that, the measures might go the other way. The only thing I would suggest is that they get in touch with the Department of Education, Sport and Culture, who obviously runs the Villa and Gaiety. I don't know what the terms and conditions of the booking would have been, so I would imagine that will be dependent on whether they can move anything back. Is
it good practice for people to wear a mask if they're going to the cinema or going to a theatre event, or are we completely relaxed about that?
We're completely relaxed about it. There is no advice saying that people should be wearing masks. Again, it comes down to, Paul, what people are comfortable with. If again with masks, I do need to emphasise it doesn't protect you from getting it. The best that it may do is that there's some evidence that it may protect people around you from yourself. If people feel more comfortable going to the Villa, going to the Gaiety and wearing a mask, just as some people do when they go to Tesco's or the supermarket, they feel more comfortable wearing a mask. That's entirely their personal choice, and they should do what makes them feel comfortable.
Fine. And I know you got a Father's Day lunch to go to, so I'll make this one more question. Will you now be encouraging people to go to Tynwald Day? And on the back of that, by the way, you're not all going to be wearing masks, are you?
No, we'll be wearing the top hats as normal, Paul, but no masks. In relation to Tynwald Day, obviously it was very different earlier. If people want to come down, then they're more than welcome to now. It's not the Tynwald Day we were originally planning with a lot of social distancing. Obviously, there's still going to be a very different Tynwald Day. There won't be the fair there. There won't be the usual guests. There won't be the usual guests within the church. But people want to come down to Tynwald Hill on the National Day of our island, then they're more than welcome to do so.
And the press has now been invited properly, so I'm very glad. I'll see you there.
Yes, and I will be seeing you on the day, I've no doubt, Paul. You can be down there with the camera.
Okay, well, we did a quick poll on Twitter about should we continue these things on Sunday, and very, very low response rate, so I think we'll keep going if we have the questions. If people have things to answer, you're happy to do it.
If you've got the questions, Paul, I'm more than happy to answer them.